Welcome to the Center for the Study of Social Policy's Perspectives on Early Relational Health series. In this fourth session, we will discuss relational partnerships in pediatric primary care between parents and providers. We hope you enjoy it. Thanks.
Hello, my name is Dr. Dayna Long, and I am a pediatrician at UCSF Benioff Children's Hospital, Oakland, and the co-director of our Center for Child and Community Health. Today, we're going to talk about early relational health. We're going to talk about why relationships matter in the healthcare system and how we actually bring early relational health to the work that we do every day. We're going to focus on talking about trust building and how to be anti-racist and non-judgmental in the work that we do with our families. I am joined today with two of my friends and coworkers. The first is Nai, who was one of our community health workers at UCSF Benioff Children's Hospital, Oakland, and one of our amazing parents, Jerome, who will talk about his experience when he interacts with the healthcare system. The overarching themes that we really want to focus on today are what approaches are most effective and meaningful in being relationship-centered, and how we can all move to a future state where we are lifting up the power and the voice of our families. So I'm going to start this conversation by asking a couple questions. And the first is, Nai, can you tell me a little bit about what you do at the hospital?
So I am officially a health education coordinator, but within that role in the primary care clinic, I do many things, like also involved in research and different programs like the Resiliency Clinic and also the Find Family Information and Navigation Desk. And with that, I usually am involved with like going into patient rooms and connecting families to resources and getting to know them a little bit about that. And also with the Resiliency Clinic, we outreach to different families and connect them to the program and then run them through the series of 6 sessions. And then that's how I met Jerome. So yeah, Jerome, did you want to talk a little bit about yourself?
My name is Jerome Traylor. I am a parent of 2 beautiful children this time. Daughter of 2 years old and my son of 6 years old. So he's in kindergarten, she's in preschool. And it's a full life. It's a never-ending cleanup, chase around, play with me, come find me world. So yeah, my Bible story with my wife, not with us anymore. I used to be the fun parent, right? Just to play, and she was always the disciplinary one. And now I find myself having to really step up on the disciplinary. So
they're lucky to have you, that's for sure. Nai, I'm wondering if you could talk about why this work is important to you. You spend your full time at work coordinating the Resiliency Clinic and helping to resolve unmet needs that families have in terms of social drivers like food or housing. Why does this work matter to you?
I think this work is really important to me because I kind of grew up in, the same type of community as a lot of the patients that come to the clinic and a lot of families that we do see. So for me, like I grew up in Richmond, so low-income family, the daughter of refugees. My parents are immigrants. So we are on the receiving end of many of the same needs and services that many of our families also had to go through. So I kind of know what that feels like to be on the other end. So to be in the room and talk about these unmet needs with the families and kind of going through, helping them navigate the system with them, it's something that I wish I had when I was younger. So that's why it's really important for me. And then just knowing that, all of the stressors and all of the ACEs that families go through and the trauma that they carry with them, it's really important to have something to help them talk about it, stress, manage their stress as well. And that's where the Resiliency Clinic comes into play. And that's kind of doing like a full circle work where I go into the room and talk about their needs, and then also offer the Resiliency Clinic where they can come and meet us with the group and, you know, kind of go over their mental health needs in a way. And so, yeah, it's been really fulfilling for me, and just giving back to the community that kind of is similar to what I grew up in.
Can you speak a little bit more about what the Resiliency Clinic is? What are the goals, and what do you hope to achieve with families during the Resiliency Clinic?
Yeah, so the Resiliency Clinic is sort of like a program that we had in the clinic that is 6 sessions long, so weekly for 6 weeks, about an hour long. And we have a pediatrician, a mental health therapist, myself, and like an early intervention specialist on there as well with the families. And what we do is like, we're really focused on strengthening like parent-child relationships, learning different mindfulness techniques, and then overall just learning about stress management and coping with, like, you know, being a parent as well. So that's kind of the overarching themes, I guess, of the different sessions. And we just go over it weekly, and we talk to the parents about those topics, and then we have discussions and conversations with the parents about it.
So when you talk about techniques, that really seems to be focused on capacity building to regulate stress. Can you share some of those techniques with us?
Yeah, I think the main thing, or one of the main ones that we definitely go over, is just deep breathing, focusing on, you know, taking, like Jerome said, taking a step back and breathing, and just reassessing the situation, and just like recognizing that you're the adult in the situation. And one of the things that we like to say is like, we have to be the bigger, wiser, and kind person in the room, because our children, you know, they look up to us, and they need someone who's going to take charge, but are equally as kind as well.
So Jerome, how did those techniques, how were they helpful to you? And how have you seen yourself rely on them when necessary?
Just taking my time more than just jumping into it when, you know, when they would get me upset or they would do something out of order. Instead of just jumping into the situation, I would first just like breathing was always believe me, it's the simplest thing to do, but you really don't think about it if you just breathe, take a deep breath before you enter any situation, it helps tremendously. I started to realize, you know, what level should I take this at? Is it really a scream and yell, or is like, hey, this can be fixed? When the techniques, when they start, you know, we start talking and I start applying them to my just everyday life, you know, I'd see the change in how I would act to them, and in turn how they would react towards me, you know. And it does, it gets better, because now throughout this time, my kids they seem more temperamental, you know, it's easier going, so I'm not yelling as much. Simply put, you want to be that parent that your child can confide in or run to when they're hurt, when they're going through something mentally. In the book, it literally had a picture, like a circle going around from the point of the child being upset to, you know, different stages where he comes back to the parent. And I was like, yeah, that's what I want to do too. That's who I want to be, you know, even if, you know, the situation, you know, kind of started with me, I want to be the one that you come back to, you know, to say, hey, it's going to be okay. Even though we went through this, it's all right. You know what I'm saying? That healing process that you give a child, you know, to tell them, hey, it's all right. You know, this is not that bad. We can make it better. We can do this. You know, we're the team.
I think you mentioned before, Jerome, like the special time. That was something really.
Yeah, special time also was another technique too that I'm still working on, because I have 2 children, you know, of different ages and different genders. So, you know, and each child kind of requires their own specific special time to really identify with them, take time out. That builds relationships with your children also, that I find helpful.
Now, what other techniques are shared in the Resiliency Clinic?
Just recognizing, you know, the emotions that you're feeling, and then naming it, and describing what's going on so that your children can also start to understand and be able to name the feelings. So that was another thing. The time that we were talking about was just to dedicate, whether it's like 10 minutes, 15 minutes, an hour, whatever, set aside the time in your day to just really focus on each child and what they want to do. So let them lead and have no other distractions so they feel connected. I think the main thing was that like children want to be connected to us.
Yeah. And I also remember that recognizing your children's moods that they're in, happy, sad, disappointed, what I'm saying? Some things might be just the smallest of minute, changes in their attitude, but you as a parent, you would want to try to pick up on them,
Thank you for that. Jerome, I know that you've spent time inpatient as well as in our primary care clinic. Can you share what your experiences were during some very scary times for your family, even about how you felt the hospital staff was building trust with you? And ultimately, I want to ask sort of what you think that we as a health community can do better to support you.
Oh, well, yeah, through this last year, yeah, children, they get sick, the school year. And that's set aside from the pandemic and COVID, but yes. So yeah, we've been in the hospital a few times, just for colds. And one big time was my daughter was diagnosed with having pneumonia that I was unaware of, whether it be the slight case or not. But yeah, when I was in there, like I said, I was pleased. They, professionally wise, they were good. They done the job, adequately. And I like I said, I was pleased. The transition was good. Personally, I'm pleased as well because, like I was telling another nurse, you never know they have the protocol that you have to be checked for COVID before you come and visit. And I actually need a break this particular time. I was there. My daughter was in the hospital for a week, with the pneumonia, and I needed a break. You know what I'm saying? And there was nobody that actually had their COVID test or been tested for COVID that they can come and relieve me so I can go home and, maintain myself and then come back. And, the nurses were very kind, sweet people, hey, don't worry about it. Hey, go home, take a shower, do what you need to do, clean up, whatever, we're great babysitters, were her exact words, I'm saying. Of course you're going to be kind of skeptical because, it's my child. And first of all, they're sick, but then, hey, I don't want, you're just skeptical of somebody else looking after them, even though it was, a couple of hours, but still, that's how I felt. She's 2, she's my little baby. And, but when I came back, contrary to everything, I was a little jealous because, they somebody says, oh man, we had so much fun. She walked with us down the hallway, and she didn't walk with me when I was, she took a couple of steps, she wanted to go back and lay down. And, oh, she ate this and we colored. And I'm like, hey man, I was happy. I was glad, don't get me wrong, but at the same time, I was a little jealous, like, hey, you didn't do that with me. Why? What makes these guys so special? But they are the staff they were angels. They were good. I appreciate them on that level too. So professionally and personally, I did, I appreciated the effort that they put forward.
Nai, what are your thoughts around how we can best be supporting communities and helping to build relationships and attachment and supporting the social emotional well-being of our youngest patients and their parents?
I think something that we all can do, like when we go into the rooms with patients and their families, is just to show up and really be genuine and really listen to what their needs are and let them kind of lead the conversations and what what they really are there to see, and what they need, what their needs are basically, and genuinely caring about their issues, because they are holding a lot. They're going through so many things, and it's tough and it's hard to be so vulnerable in a clinic or a hospital setting, and you're scared for your kids and, you know, their health. And then if you feel like your provider is not your advocate, then it's really hard to create that trusting relationship where you feel like you can tell them exactly everything that's going on. Because I feel like there's many times when there's you know, quite a few times where I go in a room and the patient can tell me whatever, everything that they are going through, and then I tell the doctor or whoever, and they're surprised that they didn't know that information. So I think it's just going in there and genuinely listening and caring about what their issues are.
Thank you both so much. Go ahead, Jerome.
I agree. You know, you really, like I said, simply, you really want your physician or the person you're dealing with just to listen, to know those certain circumstances, but just to identify in some kind of way to bring us closer. That builds the confidence and the communication better.
I love what you're saying. That early relational health is about bringing us closer.
And you know, just I'm at a loss for words for the just textbooks saying, "Oh yeah, I know this situation," and put you in this category. No, it's not like that, because each person is an individual. So, and you have to take it that it might be a little more tedious for the physician or the person itself, but it really helps. You're really going to come across and help that person more if you take it more personal.
I agree with you completely. So what I'm hearing from both of you is that it is about sharing lived experiences. It is about being open and receptive, not just following the textbook, but really leading with your heart as well as with your mind. And that it's the relationships that bring us closer and that actually promote health. I love the fact, Jerome, how you stated that you're here, right? You're here for your kids. You want them always to come to you, that sometimes there's disruption that needs repair, and they know that you have open hands. You have open hands always. And that's what relationships are about. It's about having those open hands.
That's what it was stated in the Resiliency Clinic. That's, man, thumbs up to them, you know, saying that this, man, keep funding their project. That it helps, you know, just like I said, even for reconfirming, just, you know, some things you say, oh yeah, I knew that already, but just to bring it to the forefront and keep it in mind. And that was one of the things that Resiliency Clinic is about.